So yeah, I'm gonna attempt. So my specialty is in pediatrics, but I'm going to cover all age assessments, so birth through 100. But I will say, I imagine it's slightly skewed for pediatrics. So if there are questions that I'm talking about something and you're like, what about my 25-year-old? What about me? Please stop me and call my attention to that.
But I think we were just in the same session, and they had said that we need to get the neuro, so they kind of were recommending to come here.
Sure,
So that's why
sure.
it's kind of
Gotcha. Yeah, absolutely. So, yeah, my hope, thank you so much for that introduction. And my hope today is, to talk about neuropsychological assessment, what it is, what the benefits could be, what kind of questions can we answer with that, as well as to talk a little bit about the other types of assessment that are available. And I really welcome questions throughout. This is supposed to be, this is to be helpful. So if there are things that you're wondering, if there are things that you want to make sure that I cover, please interrupt and ask questions. For the sake of the camera, I will probably try to remember to repeat your questions, or if you come up to the mic, either is good. All right, so Fiona introduced me so well, but just super briefly, who am I? Why do I get to give a talk like this? I got my PhD in clinical psychology at the University of Connecticut with a specialty in neuropsychology. So that's going to be true for most neuropsychologists. They're getting their doctorate degree in some kind of psychology, and I'll talk a little bit more about that in a second. So I am a licensed clinical pediatric neuropsychologist. Any kind of neuropsychologist who does clinical assessments needs to be licensed in their state. So I am a licensed practitioner. I have my license in Minnesota and Colorado. I work right now in a clinic at the University of Minnesota at what's called their Masonic Institute for the Developing Brain. There I do some research, like Jonah talked about, the infant study for ACC with Lynn Paul. And then I also work in a clinic there where I see people who are coming in with clinical questions, a lot of times with medical conditions, but also for like autism spectrum disorders. And like she said, I'm a researcher on the infant study. I'm also a mom to a 1-year-old and a somewhat reluctant Midwesterner now in Minnesota. I'm from Colorado originally, but I've lived in a lot of different states. And that's relevant because, as I'm sure you all have heard through many different talks, right, like different requirements, different things, support services, et cetera, are different state by state. So it can be helpful to have kind of state-specific knowledge. That's a little about me. So what is neuropsychology? It is the study really of how the brain produces behavior and how behavior is altered when something happens to the brain. So like that brain-behavior relationship. Neuro means brain, and psychology is thinking about behavior, including cognition and social interactions and emotion. And a clinical neuropsychologist means that you are someone who is working with patients directly. There are other types of neuropsychologists that are employed in many different ways. Some are just specifically researchers. Some work in forensics, meaning they work in the court systems. Some are just teachers or professors. So they are consulting in different ways. But if you are looking for an assessment for yourself or your kid, you are looking for a clinical neuropsychologist, someone who works with patients. To become a neuropsychologist in the United States, this person needs to have done a doctoral degree, like I said. So you get your bachelor's degree, and then you go and apply for doctoral programs. Neuropsychologists are like PhDs or PsyDs, not MDs. So we are not neurologists, we are not psychiatrists, we do not have a medical doctorate. We either have like a doctor of philosophy or a doctor of psychology or sometimes a doctorate of education. So you have to go through all of this schooling in order to be a clinical psychologist or a counseling psychologist. Typically you have to have had specific classwork and coursework and practicum experiences in neuropsychology. So you have to have kind of had your eye on that for a while, and then you have to complete a fellowship specifically for neuropsychology. So it's a highly kind of like specialized and trained. So not every psychologist that you meet is able to do neuropsych assessment. So it's important when you're looking for, I need a neuropsychologist for my kid. It's not just kind of any psychologist. So what do neuropsychologists do? So looking at these two different brains, we might think that, on the left-hand side, we have what is quote unquote a typical brain. And on the right-hand side, we have, something that a radiologist would read perhaps as like severe hydrocephalus. So a significant amount of fluid in their brain, increasing the size of the ventricles. And, someone might look at that picture of the brain and say, oh wow, that person is likely like very impacted because their brain looks so different from this typical brain. But what then our neuropsych assessment might show you is that actually that person has an average IQ and is, has average academic skills. And so that just because a brain looks a certain way does not really tell you very much about function. It might give you some clues as to what areas might be a challenge or might be strengths for that individual, but you really can't predict how someone is going to behave, what their level of intellect is going to be just by a picture. So I think that's where neuropsychology comes in and says, okay, maybe this is what your brain imaging scan, your radiologist said, but how is that impacting your behavior? How is that impacting your ability to participate in daily life? So yeah, brain structure does not equal brain function. So what does a neuropsychologist do? The main point is to evaluate a person's thinking skills as well as their emotional and behavioral functioning. So this is just sort of an example. We're going to get a referral from a provider a lot of times. So that referral can come from a primary care physician, can come from a neurologist, can come from yourself. Kind of depending on the clinic and how it's set up. And so this example is, this referral comes from a neurologist, oftentimes saying like, hey, I have this 12-year-old male patient. He has a genesis of the corpus callosum. A lot of times you're coming to see us because there's a concern. I would say if you don't have any concerns and you're functioning very well in your daily life, like there's no reason to come see us for anything. So usually there's a cognitive concern. A lot of times, for kids, this shows up as like, I'm having a challenge in school, having difficulty making friends. For adults, this could be something like I'm having a challenge in my workplace. I'm forgetful. I'm struggling to kind of stay focused. There's usually some kind of cognitive concern or complaint. And then with that information, we are going to conduct a clinical interview, oftentimes with the patient, kind of depending on their age and their parents or anyone who is kind of significant person in their life. So an adult that might be a partner or a roommate or still a parent. We're going to conduct a clinical interview and get a lot of information about your history, which I'll go into a little bit more later. And then based on what you're coming in with, based on what questions you have, the concerns you have, what questions and concerns your providers have, we are going to assemble a battery of tests. And with those tests, we are going to kind of try to determine what your personal strengths and challenges are for your cognitive skills. We will do all of that testing, and then we will come back to you with what we found. So we will provide feedback, all the results of that testing, any diagnoses that are appropriate, recommendations. All of that is going to be provided both in verbal feedback as well as written feedback in the form of a report. I'm going to go into all of this a little bit more detail, but this is just kind of a general overview of like, what does this process look like? Where can you get a neuropsychological evaluation? So you can Google neuropsychologist in my area, and different things are going to come up, but there are going to be kind of three main places that you can look for a neuropsychologist. One is a private practice clinic. So this is a person who is a licensed clinician, a licensed neuropsychologist, and they have decided to open up their own practice, and they are going to advertise. They will come up on your Google searches, and because they are trying to advertise and get their name out there, and they can provide these services. I have worked in hospital clinics and university academic medical centers. A lot of times, a great way to get a neuropsych evaluation, to find where you can find one, is by asking your neurologist if you or your child is hooked in with a neurologist or neurosurgeon, or a primary care provider. So oftentimes within their medical system, they have neuropsychologists who work for that clinic and are able to provide those services. Sometimes to come see me, I need to have a referral from a primary care provider or a neurologist or someone, so that insurance will cover our appointments. So a lot of times that's a good place to start, is asking your child's medical providers to put in a referral or give you a set of referrals for neuropsych testing. Sorry, did you have a question? Okay. Yeah, so neuropsych testing is certainly not the only type of testing, and it really depends on like what your question is and what you're trying to get out of the assessment. So this is just like a small sample of other types of assessments, and so if people have specific questions about, what about, I'm interested in learning this type of thing, happy to answer questions about it, but these are some common ones. Starting at, birth, early intervention is one of the first types of evaluation that we think about. If you're in the United States, then your state, likely through your school district, will provide early intervention. A lot of times kids who have any kind of disorder of the corpus callosum, because they have that medical diagnosis, they are going to automatically be hooked into early intervention services. Those folks are going to come likely to your home and conduct kind of a brief assessment to determine your child's needs. Do they need physical therapy, occupational therapy, and they're going to provide those early intervention or like birth to 3 services. So, one of the things we think about, I see a lot of young kids, but a lot of times your early interventionists are going to be able to do a similar thing to what I can do at that age. The number of different tests we have for early childhood is very limited, and we all kind of tend to do the same assessments. So it can certainly be helpful to have a neuropsych assessment at that time, but a lot of times we're just going to tell you to go get early intervention. So that is a really good place to start. Your primary care provider should already be thinking about that and hooking you up with those services. Another type is through the school district. So an unfortunate thing is that if you come to me and say, hey, I'd like neuropsych assessment because my kid is bad at reading and I think they have dyslexia. Sometimes insurance companies are going to come back to you and say, that is the school district's problem, and unless we come up with other ways of framing that concern, they're going to say that the school district is where you should start. And that is true, because even with a neuropsych assessment, the school district, if you are in United States public schools, are going to do their own evaluation. They might take my evaluation, they might consider, legally should consider what I have to say, but a lot of times they're going to do their own evaluation, so to determine whether your child gets special education services, even to determine whether they meet an educational criteria for an autism spectrum disorder. A neuropsych can be helpful in that, but they're going to do their own evaluation, and it's important to do both. You can also get assessments for a specific type of therapy. Your primary care provider may say oh, your child has a speech delay, I'm referring them to speech and language therapy. You don't have to have a neuropsych assessment to be able to start that process. Your speech language therapists are going to do their own evaluation to determine what are the areas of strength and challenge in their specific field that we can work on. Same thing, if you're having trouble at work and your primary care provider says go see occupational therapy, they're going to do their own evaluation. With a neuropsych assessment, I might say here is kind of your whole picture of strengths and weaknesses, and here are the therapies I recommend. So is a way to kind of decide which types of therapies might be most beneficial. But if you already know nope, it's language specific, I need speech language therapy, you can go directly to speech language therapist. Another like somewhat confusing differentiation is like called a diagnostic assessment. So there are certainly psychologists out there or other providers who are able to speak sort of to specific diagnostic questions. A lot of times this is a totally appropriate type of assessment for individuals who do not have co-occurring medical conditions. So, right, if you are concerned that your child has ADHD, if you're concerned that your child has autism and they do not have a co-occurring medical condition, then going to see a psychologist who's not a trained neuropsychologist can be totally appropriate. They're trained to give the specific measures that would help us determine those diagnoses. I would say that if your child, right, like, or you have a disorder of the corpus callosum, the preference would be to see a neuropsychologist because they have additional training in how that disorder of the corpus callosum impacts behavior. And a typical psychologist who does not have that training is likely not going to have that kind of added knowledge. Yeah. Yeah, so I'll talk about that too. I'll talk about it now. So her question is we can diagnose autism. And so I'll mention this again later, but there's sort of like a Venn diagram of like psychologists or other providers who assess for autism and neuropsychologists. And there's some of it like myself who have training to do both. A lot of times pediatric neuropsychologists, pediatrics specifically, have like training in autism, but that's something you'd want to ask. If your question is specifically about autism, there are specific measures that folks need to be trained on. You need to have had experience like diagnosing and evaluating for autism spectrum disorders. And so it's an important question to ask like when you're scheduling the appointment. Yeah. So there are definitely neuropsychologists who have, who have more experience with DCC. I would say that like disorders of the corpus callosum are part of neuropsych like training, but so are 1,000 other conditions. And so I'm sure like similar to your experiences working with other types of providers, that some are more knowledgeable than others. And so I'll talk about this a little bit later too, but it's really good to ask, have you seen other kids, other adults with disorders of corpus callosum? Like, what is your experience? Yeah.
Are there certain areas of the country where there are some of these? Because I know in our area, New Mexico, I don't know if anybody knows about it.
Sure. Yeah. So the question was about like, are there certain areas of the country? I would say that this is not always true, but a lot of times at these like academic medical centers are where folks who might have a little more knowledge of those types of things, and those tend to be right in bigger cities. So a lot of times those folks have had training in more kind of rare conditions, not always. Certainly I know that there are people in private practice who do have knowledge of these conditions, but I think any good neuropsychologist, even if they have only seen a couple individuals with disorders of the corpus callosum, the corpus callosum is like an important and very well-known part of the brain, and they should know what it does and then, what the absence of. Whenever I have someone come to me and they have a condition that I have not seen, a rare genetic condition or something that I have not yet seen, I do a lot of research to look at what is the literature out there, what is known, are there cognitive profiles that typically are seen. I'm reaching out to colleagues to be like, have you seen someone with this condition? So, I wouldn't be too disheartened if you can't find someone who has a lot of experience, because I'm sure if you've been at this conference and you hear like Lynn Paul talk or Warren Brown, like these are people who are established, but there are very few of them. And so I wouldn't be too disheartened by that, because a neuropsychologist who's been through training should still be able to like get the knowledge required. But it's important to ask and like show that like, hey, this is what I'm looking for. Like, I really want someone who can speak to this for myself or for my kid. And then the last one here is, right, there's all different types of evaluation processes that can be required for different like disabilities, for Social Security, disability service, Medicaid waivers, that I'll talk a little bit more about later too. Again, neuropsychology, like neuropsych assessments can be very helpful in the process of getting services. But for example, in Minnesota, right, I can do an assessment, but to get a Medicaid waiver, they're going to come and do their own whole evaluation. They're going to look over the records, but they're going to do their own evaluation to determine whether you get a Medicaid waiver. Yeah.
So my oldest child is a young man
Yeah.
who has agenesis,
Mm-hmm.
and but I have a son that is really struggling with another son who's struggling with high school, not doing well.
Yeah.
And my wife and I have often thought that perhaps maybe he has ADHD, or
Yeah.
is that something that you?
Yeah. Yeah, so the question is about, someone who doesn't have agenesis of the corpus callosum but is still struggling. Gotcha. Yeah, so, if you have a child who's struggling, have questions of ADHD, a neuropsychologist can be a great person to see, but also if you're concerned about attention or ADHD, you could, any kind of like psychologist that does assessment would be able to diagnose ADHD. That should be a really common concern that's like bread and butter for any kind of assessment. This, if you think it's impacting school, telling the school that you would like an evaluation of kind of his skills around attention is another place to start. If it's showing up like in his grades, oftentimes, what you got to do is you send a email or letter like dated to, if you're not sure who at the school is the right person to go to, like send it to the principal saying like, we have these concerns, we'd like an evaluation done for like whether he qualifies for any types of services for school. But yes, you can also seek an outside assessment and then take it to school and say, here's what was found, here's what's recommended, what can you help us with? So like I said, the type of assessment really depends a lot on like, what is your question? They can be very general, like what are my or my child's strengths and areas of challenge? Like that is oftentimes what the type of question that I'm getting is just generally we want to understand a little bit better about learning style, about some of the things that are causing challenges at home and at school. Also, like, how does having a disorder of the corpus callosum impact learning and thinking skills? These general questions are really well suited to neuropsych testing. These next two are a little more what I was talking about, like, does my child qualify for an IEP, special education services? That question needs to be answered by the school district specifically. If you have a neuropsych testing, it can give you kind of ammunition to say, like, yes, like, he should receive services. Here are the things that the neuropsychologist is recommending, but it's ultimately the school's evaluation process and choice. Same thing with kind of any similarly, we can help inform like accommodations for work if someone is having struggles in their workplace. Again, these are some of the like diagnostic questions, like, do I have autism? Does my child have ADHD? Does my kid have a learning disorder or dyslexia? That, in the broader population doesn't need to be answered by a neuropsychologist. For anyone with a disorder of corpus callosum, I would recommend seeing a neuropsychologist for those types of questions just because of their knowledge base. Yeah.
When we come to you, could we gear our questions towards certain things?
Yeah.
Based on what? Okay.
Yeah, definitely. So the question was about like, can you gear the evaluation towards certain questions that you have? Yes. Like, I think coming into the evaluation with specific questions, or like, these are the things that we want to know about, these are the questions we want answers, is really helpful. And in that initial interview, that should be kind of like the main question is like, what are you hoping to get out of this evaluation? What questions would you like want answered? And so, there's some neuropsychologists who are going to do kind of like a comprehensive evaluation regardless. That's like how they were trained. But there's certainly a movement towards more tailored evaluations, especially in the age of like insurance saying like, yes, you've asked for 6 hours of testing, I will give you 2. And so then, you want to be targeted with the questions that you're answering. If you are not concerned about your kids' math skills, like why would I test the math skills? That's not an area that's a challenge. So yeah.
So that's a reasonable ask.
Absolutely.
Kind of talking to people, and our educational advocate has recommended finding someone who gears it more towards our son's 3.
Yeah. Oh, sure.
Early,
Yep. Yeah, absolutely. It's definitely like reasonable to ask for kind of a tailored evaluation and a good question to ask them of how they would approach things. And for a kid who's 3, there's going to be kind of like limited areas that you're going to test anyway. So it should be a very targeted, and it should like not be very long because any 3-year-old is not going to like last more than an hour or a couple hours. Yeah.
Are there recommendations for with your kid with ECC?
Yeah.
What he should specifically ask for to memory?
Yeah.
Evaluation?
Yeah, that's a great question. So the question was about like for a kid with DCC, like what types of things might you tailor the assessment around? And I think some of that is specific to the kid of like, what are the things that you are noticing in their day-to-day life that are an area of struggle? Like, is that process, like they're taking too long to process information, they get overwhelmed by too much information, or like attention problems, or they're having a hard time expressing themselves, describing to the neuropsychologist like the things that you're noticing in the day-to-day life. And it's their job then, right? Like it's my job to take what you are observing in your daily life and translate that into like the specific cognitive areas and tests, right? You don't need to come in and say like, oh, it's like processing speed and working memory. Like that's not your job at all. That's my job to take like, what are the things that you're noticing and translate that into like, what are the skill areas that I would want to assess based on that. Yeah.
Are there specific ages like that you would suggest, like an age
Yeah.
that makes them comfortable, or like?
Yeah, I'm going to get to that in just a second. Yeah, great question. So yeah, some of these other areas like applying for Social Security, a neuropsych assessment can be really helpful. I'll talk about a little bit. I see Ron back there. That you're going to need like an IQ score and an adaptive skills test, and I'll talk about that in a little later. Like you're going to need specific tests to have been given in order to qualify for some of these services. Similar with like guardianship, there's like a specific process that happens, and you're going to need specific tests in order to go through that process. So what should you consider when finding a neuropsychologist? First and foremost, like insurance cover and payment. A lot of times in a private practice, those are going to be out of pocket. Maybe they take certain types of insurance, so you would want to check, do they take our insurance? Like call your insurance company, be like, is this going to be covered? I have not run into, if they take your insurance, I have not run into a ton of trouble like proving that like there's medical necessity, at least with kids. But check to see if they take insurance. The other piece of this kind of medical necessity, right? Insurance is going to cover it if they deem it medically necessary, which means sometimes I'm filling out prior authorizations, and what I need to use specific words that say like this person has challenges in cognitive areas that are not just academic. So it's helpful for me if I know that like, oh, they're having difficulty with memory tasks, or they are not like making progress. It can certainly be based in academics, but your neuropsychologist hopefully is going to like translate that a little bit to help get it covered by insurance. Yeah.
Is there particular like cadence that they like to have? Because I want to go every year.
Yeah.
Last time they said, no, you need to wait a year.
Yeah.
And is there a way that I can get back to the cadence I want?
Yeah, that's a great question. So a lot of times insurance is going to say like 1 a year. And for, a lot of times there's good reason for like not having more than 1 a year. Like you don't need that most of the time. I have a slide in a couple minutes about kind of like the times where we recommend like a general schedule. But a lot of times, if someone's coming to me and saying like, I've seen a change, there are new concerns, then I can make an argument for saying like, hey, this is required, like this is necessary because, you know, things are not status quo anymore. There's been changes. So another piece to think about for the neuropsychologist area of expertise. So myself, right, I specialize in children. I had training in lifespan, so in geriatric and adult assessment too, but you know, most of my expertise is going to be with kids, and people, it should be pretty clear whether they are an adult neuropsychologist. Lifespan means they see all ages. Like I mentioned, if autism is a specific question of yours, you're going to want to ask. A lot of times neuropsychologists don't feel super comfortable diagnosing autism because they haven't had that training, and so that's something that you want to ask about specifically, especially because sometimes people find that out at the end and then are referred to like yet another psychologist to do the autism evaluation, which means you're sitting on another waiting list. And so if you can not have that happen, or if you can like immediately get on that waiting list because you like know from the outset that's a question that you have, that's important. Yeah. No.
Is there ever a time where it's better to use a private neuropsychologist as opposed to unassociated?
Yeah, the question was about, that's a great question. The question was about, are there ever times where it's better to use a private neuropsychologist than someone in like an academic medical setting or a hospital? Yes. I would say that private practice neuropsychologists oftentimes have more time to spend. So if you are someone who's like, I want this to be like incredibly thorough, I am not like, it's because they are not bound by the like demands of the hospital system saying like you need to see a certain number of patients. They get to determine that, which means oftentimes they get to spend more time. They are more able to, like, I will do my best oftentimes to like attend an IEP meeting if it's necessary, or to talk with teachers, etc. But a private practice neuropsychologist, because a lot of times you're paying out of pocket, like that is all included in the service that they're providing. So they will go to IEP meetings, they will have ongoing like consultation and stuff. And I, you know, folks in the academic medical setting or hospital setting will do their best to do that, but have a little bit more limitations around their ability to like do these other things or spend a ton of time. Another piece to look for is if you or your child have sensory differences, so vision differences, hearing differences, then making sure that the neuropsychologist is aware of that and is capable of assessing someone with those needs. Same thing for if the person being assessed is nonverbal, that you want to make sure that the neuropsychologist feels comfortable assessing someone who doesn't use language to communicate. Also language spoken, if you are someone who, you know, in the United States, people are going to be primarily English speaking. There are definitely bilingual neuropsychologists out there, but you want to make sure that they have interpretive services or that the neuropsychologist speaks the language that you feel most comfortable in. And then training. So some folks are board certified. It's not required in our field, but if you see these little letters, ABPP, after someone's name, it means they've kind of gone above and beyond to get specific training and take specific tests that show that they've demonstrated like expertise in this area, and then that they are a licensed practitioner. If you're going to like a hospital system or medical system, right, that has all been vetted, so you don't need to check on that. So how is cognition measured? This is oftentimes through different kind of puzzles and paper, pencil tasks, tablet tasks. These are the domains that most of the time we are thinking about. So global cognition or intellectual abilities, what people think of as IQ, academic skills, language, visual spatial skills, which is kind of what's represented up here in this puzzle. Attention and processing speed, learning and memory, executive functioning skills, which I'll talk about a little more in a second, motor skills, as well as like psychological, social, emotional functioning, and performance validity, which just kind of means like, did you give good effort on the tests that we were doing? So how should you prepare for your assessment? So you've talked to your PCP, you have an assessment. I will say a lot of times there are like pretty significant wait lists. I guess that's another benefit of a private practice is sometimes they have shorter wait lists, not always, but sometimes. You've been on the wait list, you get off the wait list, it's time for your assessment. All of this should be communicated to you by the clinic, by the neuropsychologist of what to do in preparation or to bring. But in case they don't, it's really helpful to gather any relevant records. So if they're in a medical system and you have been, like I work at the University of Minnesota's medical system, and I have access to electronic medical records. So you don't need to bring medical records to come see me because I have access to that. But if you are going to someone in a private practice, they very likely don't have access to those medical records and would ask you to bring any relevant medical records. So for an individual with DCC, like that might be a note from a neurologist or a radiologist talking about the condition or what they see on imaging. If you have a genetics report or have been seen by genetic counseling, those are important records to bring. Any past assessments, so if you or your child had an evaluation done through school or early intervention or had a previous neuropsych, that's really helpful to see. And then any school records like current IEP, a school evaluation. And then thinking about like who should come to the assessment. If it's an adult child, a lot of times they still would like parents to come as kind of like a collateral reporter. Even like if I were going to get a neuropsych assessment for myself, they would likely want my partner to be there to talk about like what does he see that I might struggle with on a day-to-day basis. So they're gonna let you know who should come to the assessment. And it's very likely that like that other person, if you're an adult, doesn't need to be there that whole time. Maybe they just need to be there for like an hour for the interview or something like that. Talk with teachers, therapists, providers, other people who have information on your child. When I see a kid, I want to have, I'd like teachers to fill out questionnaires because they're seeing them in a totally different context than the parent and then what I'm going to see. So oftentimes just letting teachers or therapists or providers know like, hey, we're going to go get a neuropsych assessment. Like, is it okay if I give them permission to reach out to you? Or letting them know like, hey, expect a questionnaire might come. Medications, you're gonna like any medications that is like required for your physical health, they're not going to tell you not to take or anything like that, but just having a list of like what are the medications that you do take or your child takes. The only time why this might be a little different is if they're if you take stimulant medication or medication for ADHD and one of the questions is specifically about attention, they might direct you to not, or your child not to take it the day of testing to see kind of like without that medication, how do things go? But that's something you'd want to ask specifically about. And then, like I said, yeah, come with your questions and concerns. Come with, I've had people give me like their whole written out list of questions or concerns. You don't have to have that at all to prepare. They're going to ask you specific questions that should bring up all of those things, but it can be helpful to jot those down beforehand. So yeah, what does the assessment look like? So a lot of times, before COVID times, almost always it was going to be in person. Now there's some mixture of in-person and virtual options. But most of the time, these days I think people are trying to do this in person. If for some reason maybe you live far from the city, you live far away, you can ask like, is there any part of this that can be done virtually? Or like, you have a 3-hour drive back home. Sometimes portions of it can be done virtually. It really varies in amount of time, so that's good to get an idea about ahead of time. It can be from like an hour to like multiple days, full days of testing, depending on kind of the questions that you're trying to have answered, and what is available to that neuropsychologist. If you have a choice, try to schedule it for a time where either you or your child is at their best. So like for young kids, I am always trying to see them like at the beginning of the day, like after nap, after they've had breakfast, in those couple hours, because that is where I'm going to see kind of their best skills. Because a lot of times you're not going to get valid testing if you or your child is tired or hungry or like having a hard time. So if you can do it, sometimes, they have one time that you can schedule it in and you don't have a lot of choice. Like I said, they're going to get a really detailed history from you. When someone comes to see me, I've already gone through their medical record, so I should have thorough knowledge of kind of their medical history. If it's a kid, they're definitely going to want to talk to you as the parent, to get a sense from you, like I said, what are your concerns, but also kind of like birth history, medical history, how are they doing in school, what do you see with friends, what are things that they're interested in, all these different areas they're going to ask you questions about. And then same thing for an adult, right? They're going to ask the individual questions if they're able to participate in that, but they might like to ask parents, they might like to talk to a partner or roommate or someone else who can talk about the person's needs. Then you're going to do tests. A lot of those are paper pencil tests, like I said. Sometimes they're on tablets now. There are also going to be a lot of different questionnaires where you're reporting on, attention symptoms in your daily life, or might ask questions about mood or anxiety, and then teacher questionnaires to see, how are they in a school environment? What are the areas of needs there? After all of that is done, they should provide feedback. Sometimes folks are providing feedback that same day. Sometimes they are scheduling another feedback session because they need more time to kind of score tests and put all that information together. They should let you know at the beginning what to expect. And then after that feedback report, or sometimes at that same time, you're going to get a written report that details all of that information. And the level of detail in those really varies also depending on the question. If you're getting a comprehensive neuropsych assessment, it is going to be a really lengthy and detailed report, versus, say you had a concussion and you just need to know can I go back to playing sports? That's going to be a really tiny report, yes or no. When you're doing these tests or when you get these reports back, right, we are comparing your scores or your child's scores on these tests to other individuals your age. So if in the case of our 12-year-old from the beginning, how is this 12-year-old with DCC doing on these tests compared to other 12-year-olds? And they're comparing it to typical 12-year-olds, so not 12-year-olds with DCC, not 12-year-olds with medical conditions. It's kind of in the whole community of 12-year-olds, where is your kid performing? And they're gonna then use words in the average range, in the below average range, in the low end of the average range, or the high end of the average range, to describe where your kid is performing on these different measures. And this is what they mean, right? That most people are broadly in the average range on these tests, and that each of the scores that they give is going to line up with kind of a, where they're falling in comparison to their peers. And this should be, no one should be giving you a score and not interpreting it for you, right? That's what you're paying us to do, is we get the scores and we are interpreting it in a way that makes sense. That is what the assessment is for, not just giving you scores and being good luck. A couple notes about specific areas of assessment and function. One is IQ, or global cognition, intellectual ability. This is giving kind of a baseline for this is where we think your general thinking skills are. And most of the time, people are going to include this in a neuropsych assessment. Sometimes an IQ score, which is just one number to kind of represent a whole bunch of skills and intellectual functioning, is required for things like disability services, Social Security, for IEPs sometimes, if you're trying to get into a gifted and talented program, for guardianship, and definitely for a diagnosis of an intellectual disability. So there are a lot of instances where they really want an IQ score. I think most neuropsychologists say that, like, yes, an IQ score can give you an idea of someone's functioning in a broad way, but there's a lot more nuance and there are more things to consider, but a lot of systems are going to say, like, give us the IQ score, like, that's what we want to see.
Do you know the IQ score or the range that's required for disability services in Social Security?
I feel like Ron has an answer to that.
It's not determinative.
Yeah.
So a low IQ score is helpful in guiding development, but it's not a single factor that they can accept.
Yeah. A lot of times too, like, in thinking about schools or early intervention, kind of like use different cutoff points. When thinking of a diagnosis of an intellectual disability, usually that's someone who is scoring below 70. So in this area on an IQ test, there's some like wiggle room around that, but a lot of times we're thinking about individuals who are kind of in the below average, significantly below average range, who are qualifying for things like that. You do not need to know like the common tests necessarily, except like you can ask, like, will an IQ score be part of this assessment? If one of these things are something that you're trying to get, if you need an IQ score, you can just ask, like, will an IQ score be part of this? I need it to, for Social Security application, I need it for disability services or for guardianship. And they should be able to let you know, yes or no. These are some of the tests that you would be looking for. So you could ask about specific tests, but like you should be able to just ask about an IQ score. One note I will say, sometimes there are individuals who are not able to complete kind of the standardized assessment for their age, right? So at the age of 16, we kind of graduate people into the adult version of an assessment. And so in order to compare you and say where you fall compared to your peers, you need to be able to complete this assessment. Sometimes there are individuals who are not able to complete that assessment, and so a neuropsychologist needs to kind of make an argument for how they're going to assess that individual. There are many ways to do that, to speak to kind of their skills using assessments that might be outside of their age range. Maybe they're meant for younger people, but can still give us an idea of function. But if you are trying to qualify for different services, sometimes they need to like make a really clear and strong argument about like what their testing procedures were, why they did that, and like what they show. Yeah.
Quick question. On giving an assessment to a child with DCC,
Yeah.
we all know that processing time is
Yeah.
a big indicator. And so like with the IEP, with doing that evaluation with the school district, or like yourself, how is that taken? We do not see that taken into account. It's like a lot of things they said he cannot do, but we know he can do it because they just give him
He just needs more
time.
time. Yeah, that's a great question. So the question was about, right, like we know that processing speed in DCC is an area that is consistently implicated, and that sometimes, especially in a school district or something where they're assessing the kid and saying, oh, they can't do this, but because they couldn't do it in the amount of time that they gave them. So any neuropsychologist like worth their salt will know that, well, even without knowing that about DCC specifically, we'll see that like this kid is taking a longer time. So oftentimes what I do is say, okay, in the amount of time specified by this test, they were able to do X, Y, Z. But when I gave them extra time, this is what they were able to do, and to describe that, because that is helpful for school to know that like with extended time, here's what we could expect. And that's where a neuropsychologist is going to have that knowledge and be able to push the bounds, where a school doing an assessment may not think about that, or might not have the time to do that. But that is something like that's really emphasized in our training, is sort of the limits of the standardized test and when to kind of push beyond that, and how to do that like in a ethical and valid way. But yeah, so that's something I'm always thinking about, especially for a kid I know is going to have slow processing speed. Like, still helpful to know, like, in comparison to other kids their age on this standardized measure, this is what their score would be. But if I give them extra time, or if I, sometimes it's a kid has terrible attention, and so they needed like constant reminders to focus on what they were doing. With those extra reminders, like, here's what they are able to do. Oh, that's a great question. Similarly, adaptive skills testing. So this is asking about what a child or what you yourself are able to do in your daily life, like functionally. So a lot of times, right, we see that a kid, can take a shower, but like, will they know that they need to take a shower themselves without a reminder? This is kind of trying to tease apart like what an individual like can do, but what they are like functionally able to independently do in their day-to-day life. Most of the time this is being measured through a type of interview or questionnaire with a parent or the adult themselves. And this is another score or another set of scores that is often required for disability services, Social Security, guardianship, and is required for a diagnosis of an intellectual disability. It used to be that like you could show an IQ score and that person would be given an intellectual disability diagnosis. That's no longer the case. You have to demonstrate that you have significant challenges in these adaptive skills. Yeah. Mm-hmm.
Fill it out from the perspective of their child on their best day?
Oh, that's such a good question. So the question was about like, do you fill it out thinking about your kid's best day or your worst day? And I, it's like such a cop-out answer, but I usually say like the most typical, like what is most typical for your kid. So oftentimes we're saying thinking in the past, month, what was most typical for your kid on a day-to-day basis. And they usually, these are the two most common measures, the ABAS and the Vineland. And they are giving you some leeway where they're saying like, you can always do this, sometimes do this, or like rarely do this. So there's a little bit of leeway where you can like hedge a little. But usually we want to say like, what is most typically true for your kid? And then I'm not going to go through all different areas, but in addition to processing speed, right, which comes up a lot in DCC, executive functioning skills, I think, come up a lot, or these kind of like higher level problem solving skills. And executive functioning skills include all of those things in the nice wheel over there, including organization, planning, impulse control. It's all the things that we need in order to make progress towards a goal. So a lot of times these kids start to learn these skills. Impulse control is something that we start kind of very early on teaching, but we see executive functioning skills come under stress as kids get a little older, like in middle school and high school, when they're being asked to manage multiple different classes. They're being asked to plan for longer term assignments, like, okay, I know I have this assignment due in 2 weeks. What are the steps that I need to take in order to be able to complete that assessment or that project? All of those things require executive functioning skills. And that, the demands of those really increase as we get older. And it can be an area of challenge for individuals with a disorder of corpus callosum. It's often tested both in a direct way. So I have kind of direct measures of each of these types of skills. But a lot of times, sometimes kids really have difficulty, or adults have difficulty with those in our setting. But it's also important to get a sense of how someone does with those in the outside world. In the testing setting, right, it's quiet. It's just me and the other person. That's all they're focusing on. And sometimes people who really have challenges with executive functioning skills outside of that setting can look okay in the testing setting just because that's not really mirroring real life. So it's important that if these are things that you're noticing for yourself or your kid is a real struggle in the real world, to make sure the person knows that, because they might do some extra, like their self-report, teacher report, parent report questionnaires that get a sense of like, okay, in the real world, like what are we, how are these looking? And then social emotional concerns, right? I think in neuropsych testing, we think a lot about cognitive skills like attention and learning and memory, executive functioning, processing speed, but it's really important to address social and emotional concerns as well, and that should be a part of any good neuropsych assessment. These are going to be things like assessing for anxiety, or if you have concerns about depression or OCD or autism spectrum disorder. These are good things to bring up during that interview, that intake, to make sure that that is assessed during the evaluation. A lot of times this is through questionnaires or standardized interviews or observational measures, but we know that all of these things, like especially emotional concerns, have impacts on cognitive skills, right? So we know that anxiety and depression can really alter the way that you're able to think and learn. And so if that is not being accounted for, we might totally miss like a huge piece of the puzzle that's going on for someone. Yeah, question.
Showing all these tests, all these assessments, my question is then, how is this used to help the individual? How does that turn
Yeah.
into a therapy plan?
Yep. Yeah. So the question is about how does all of this turn into a plan? And I've got a slide at this at the end, but that is, the neuropsychologist's job is to take the information, the things that you're seeing, come up with this testing plan and say, okay, here, based on these results, these are the areas of strength and the areas of challenge. And then with those areas of challenge, here is how we support those. So part of the evaluation is going to be what is their recommendation for the therapies that you should be involved in. They should be making referrals if they're in like a medical system. They should be providing you resources like here are books, here are websites, here are parent organizations. All of that should be like a big part of the feedback session, and should be in the report, like a very detailed list of like, okay, here are strengths and weaknesses, like, so what now? And you should come out of it feeling like you have a plan, like moving forward for what to do. Definitely. Yeah, sometimes it's like go back to primary. Sometimes, like for myself, I'm able to say like, if I think you need speech language, I can put in the referral for speech language and they will call you to set up that appointment. Or, if I think the kid needs a social skills group, that like, here are the places to go find that social skills group. So some of it is, collaborating with the primary care, and some of it is referrals that you're able to follow up with on your own. Yeah, so if you, it's good to sign releases to like school, therapists, primary care provider, anyone that you think would benefit from having this. That's something that they should talk with you about, right? When someone comes to see me, my report automatically goes to the primary care provider, but then I get releases for school and anyone else that they think the assessment should go to. Once the report is in your hands, it is yours to give to whoever you want. Like, I print people a bunch of copies. You can make a bunch of copies, get electronic copies, and send it to whoever. But yeah, it's very helpful, I think, oftentimes for therapists to be able to see it. So they also don't have to do, if I refer someone to speech language therapy, I've likely done the language testing that maybe their therapist would need to do. And so then they don't need to do that. So this is speaking to when to get a neuropsych assessment. So like I said, you certainly can get a neuropsych assessment in early childhood. There are not a lot of people who feel comfortable with that age range. And a lot of times early intervention folks, or those like speech language therapists, occupational therapists, they can do a good job of doing an evaluation. So if it's available, great, but not mandatory. a lot of times, nice times to get these assessments are when you're entering school. So to plan for that IEP when a kid is coming into kindergarten, to make sure that they are set up for success when they get into kindergarten. Then this kind of 3rd, 4th grade time, it's when they make this transition from learning how to read to being able to needing to read in order to access the material, to read to learn, we say. So there's sort of this transition that happens around that 3rd, 4th grade period that can be a helpful time to get an assessment done. And then again, at these kind of major transition points, so entering middle school, making a plan for that, your neuropsychologist also should tell you, come back and see me here. Oftentimes for myself, right, when kids are very young, I'm seeing them more frequently because things are changing a lot more frequently, right? The difference between a 2-year-old and a 5-year-old is very significant. So a lot of times I'm seeing them more frequently. And then as they get a little older, we see less change over time. And so then maybe I'm saying, okay, you don't need to come see me another 3 years, or at one of these major kind of transition points. A really important time to do an assessment, I think, is for planning for life after high school. So whether that's going to be, maybe the individual is staying in school through 21, maybe they are going to enter some kind of adult rehab program or vocational programming, or they're trying to go to college. That can just be a helpful time to get an assessment and to make recommendations for planning for that future piece. Additionally, if you ever notice a change in skills, so if you ever have a concern that your child or that you have had a regression in skills, like you have gotten worse at something that you previously could do or your child could previously do, that is a time to come see. Even if they've told you come back in 3 years, send them a message saying I've noticed this change, can I be seen sooner? Or, sometimes people just want to say hey, my kid was in, I certainly see this in young kids where my 2-year-old had an evaluation with you. They've made such huge gains. I'd really just like to see how much improvement we've had. And that's a perfectly valid reason to come and get an assessment too. And then change in medical status. So any kind of onset of new medical problem that might impact the brain. So definitely seizures, any kind of traumatic brain injury, concern for dementia. We can test for the impact of medications. Sometimes a medication makes it feel it's had sort of this mental dulling effect. We are able to speak to that too. Yeah.
I just want to bring up, we had a neuropsych evaluation on our person with DCC. Anyway, if your child got anger, got behavior, got aggression, and is entering into middle school, high school, and you haven't considered the legal system.
Oh, that's a great point.
You may want to get it to have that in case something happens and you need it in the legal system.
Yeah, absolutely. So the point was that, if you have a child or someone who has some issues with aggression, or if you have concerns that they might be involved in the legal system in some capacity, the transition to middle school or into high school can be really important to have a neuropsych assessment, just to say this is this person's level of functioning, and kind of what they're able to understand or not understand, certainly is really important. I guess sometimes an argument for seeking neuropsych assessment earlier rather than later is then you have a point person to say we are having this issue, can we come see you, as opposed to then the issue arises and then you're trying to get an appointment and there's a wait list. Establishing care with someone and then you are in more of an internal system rather than someone coming in from the outside can be helpful. And then, this question comes up of are these tests even accurate for individuals with DCC or ACC? So these tests, right, were not developed for individuals with ACC specifically, but, some of the work that I work with, Jed Elison at University of Minnesota, I know Lynn Paul, some of the work that we are doing is trying to say, answer that question, are these measures valid? What are the strengths and weaknesses specifically for this population? So that work is starting and ongoing. But all the more reason to see someone who can interpret with kind of that caveat in mind, that these tests were not made for these individuals, this specific population, so they have strengths and weaknesses because of that, and we need to be able to interpret them cautiously. So we want to know like the why. That's what I'm always wondering, like, why are we seeing these areas of challenge? What is going on that's causing this? But it's still important to support the area of weakness. So Jasmine mentioned in the talk that she and I gave yesterday, this idea of like, someone could be limping for a million different reasons, right? It could be like you have a blister. It could be because you fully broke your foot. It could be because like you're trying to get out of gym class, so you're faking a limp. But each of those are resulting in this limp, and we still want to support the limp. So if someone is having challenges in processing speed, having challenges in attention, we want to support those regardless of where they're coming from, but it absolutely helps to understand why. And that's why a neuropsychologist can be helpful, is because they can speak more to the why is this happening, rather than just saying like, here's an area of need, like that needs support. And a neuropsychologist should really be able to comment on the validity of the measures, the limitations of that, and why they think they're seeing the profile that they're seeing. Yeah.
Are there any tests in particular where you're not sure that they're as valid for our kids?
That's a great question. The ones that I like, I think a lot of times the like cognitive measures of attention and processing speed and executive functioning are valid measures. The thing that's going to be different is like why. So a kid may meet criteria for a diagnosis of like ADHD or something, but the cause of that is different from a kid who doesn't have DCC. And it's important to be able to speak to that and to explain why. The ones that I am finding like very challenging is like the autism spectrum assessments, because and that's one of the research questions that we're really trying to answer now, is that, autism is a behavioral diagnosis, meaning like you show these behaviors regardless of where they're coming from, and thus you meet criteria for the diagnosis. But I think we're finding that there are some like differences from DCCers who are diagnosed with autism and people who don't have DCC who might be diagnosed with autism, and that's one of the things that we're trying to tease apart, is like, how good are our measures at doing that? An example of this that has a lot of research support behind it recently is like diagnosing girls with autism. And so our measures were really made with boys in mind, because it was really thought like those are the people who have autism, is mostly boys. And then we created all these measures only looking at boys, and so it doesn't really include girls in the same way. And so now there's a bunch of research into thinking about like, how can we adjust these measures? What are the things we need to be thinking about to address this in girls? A similar sort of thing for DCC, making sure that we have good measures for that. Coming back to processing speed, so an example of this, like there can be many different reasons why. This is an example of a processing speed task that you or your child may come in contact with something similar for, copyright reasons. I won't put the real thing up there, but it's asking you to say, okay, you see those numbers, each number has a symbol, please write in the symbols as quickly as you can. You have like 60 seconds, go. And so a kid who has slowed processing speed, right, it's going to take them longer to do that. It's going to take them longer to like find what they're looking for. It's going to take them longer to write it in. That whole thing is going to take a longer time. However, you can also see really low scores for a kid who has ADHD, and they were going really fast, but then partway through, they wanted to tell you a story about something, and so they stopped. And so then they didn't get very far because they were doing something totally different. So they have the same scores, but it's for totally different reasons. And that's why, like, working with a neuropsychologist, is gonna, they're gonna look for like the why. Why did you do poorly on this measure? Similarly, someone who has really difficult time with motor functioning, who has cerebral palsy or who has fine motor challenges, they might be doing this very slowly, but it's because the physical act of writing for them is really challenging. And we want to be able to tease apart why, because you can think, if I'm making recommendations for a school setting, like my recommendation is going to be different depending on the reason behind that low score on this measure. All right, and so at the end of all of this is like an example of something that I show parents, is they should be showing you like, here are where your child's skills fall in comparison to other kids their age. Not everyone like uses a graphic. I just am a visual person and so need the graphics. But a lot of folks do, I think now, and should be showing you like, okay, here is where your child is falling in comparison to other individuals, or here's where you're falling in comparison to other individuals. Here are their strengths and areas of challenge. Here are their kind of intellectual abilities. Here's where their language skills for this person is like a relative strength versus their social language, which is more of a challenge. Executive functioning skills in this instance really depends on kind of the parameters, on the setting that they're in. And that's the type of information that they should be going over with you as part of the assessment. Then based on all that, they should also be making diagnoses. So what diagnoses do you qualify for, or does your child qualify for? And they should be very clearly documented. You should not be questioning like, what does this mean? Like, does my child qualify for any diagnoses? That should be made very clear. Here are some like very typical ones that we're evaluating for and that you might see in a report. So things like global developmental delay or intellectual disability, ADHD, autism, language disorders, learning disorders, as well as then kind of that emotional social piece of anxiety or depression, and then thinking about older adults, neurocognitive disorders, things like Alzheimer's, Parkinson's, etc. Yeah.
Question, just like would you correlate, so oftentimes my daughter with complete ACC doesn't want to do activities. Like she doesn't want to go to, gymnastics, which she loves. When she's there and doing it, she really enjoys it, but trying to get her to do activities, a lot of times, I don't want to do that. I don't want to do that.
Yeah.
Would you classify that more like an anxiety disorder or?
Yeah, that's a great question. So I think then oftentimes we want to I would be asking you more questions about kind of like, how old's your daughter?
She's
6? Yeah. Sometimes like a 6-year-old's not going to know and be able to explain to you like, oh, I'm experiencing anxiety and that's why this is coming out. And sometimes, but when I hear that from a parent, like that's a common thing that comes up, I might be thinking, is this related to anxiety? Is anxiety showing up in other ways? Is this kind of that like executive functioning piece where the process of getting from here in my home to gymnastics, like that feels overwhelming to me, all the different things that have to happen in order to get there. And so sometimes when things like that come up as part of the recommendations, I am saying like, all right, here are the couple things that we could try, whether that's like a visual schedule of some of the, like, here are the steps to getting to gymnastics, or reminding like, oh, what happens at gymnastics that you like, having pictures of that, or like, is it like you get to take like a stuffed animal in the car that feels like very comforting. So it's kind of trying to problem solve, especially with young kids where sometimes it's kind of a guess, like we can make an educated guess as to what's going on, because they don't know themselves. And then kind of like what I was talking about before, a major part of any feedback session, a major part of the report is going to be recommendations. So are there any further assessments? So especially like I was mentioning, if autism is a question, that person doesn't do autism evaluations, like here's a further assessment. Sometimes for myself, right, like if a person has really significant psychiatric symptoms, like I'm wondering about like a schizophrenia, or I'm wondering about like a really serious mental health condition, I might want some additional support with that assessment. So I might say like, here's my colleague, a psychiatrist, I would like him to see you. Here's further assessment that we can do to kind of further clarify these questions. any mental health therapies, the specific type of mental health therapy that they're recommending based on kind of that individual's specific needs, any behavior therapy that might they might think is appropriate, functional therapies like PT, OT, speech, rehab, county services, disability services. For myself, I am always hooking people up with our social worker who's able to help you navigate those like incredibly complicated, I think I did put it in. So our social workers just gave us a presentation on like how complex it is to navigate, right, the like disability services world. And this is the chart that they came up with. So, right, like you need support with that. That is impossible. So that can be a question is like, are there social workers, are there case managers available through the system? Is that something that, sometimes in a private practice, they may be able to help with yourself? For myself, I am referring you to a social worker who's able to help with that process. School, I am making recommendations for what I think, like based on my report, I think would be helpful. Schools, districts then consider it, but they do not have to do anything that I recommend. So I try to make a case for it. I try to be really reasonable of like not telling a school how to do their jobs. They are dealing with their own systems and their own parameters. But we do definitely make recommendations around that and try to empower like a parent to advocate for their kid. Like, here are the things to advocate for. Here's how to make these requests. Any workplace accommodations that we think might be useful, or workplace like vocational programming, things like that. Social skills group, medical referrals. A lot of times I'm referring people to like a developmental behavioral pediatrician, genetics, neurology, a sleep study if sleep is really concerning, dietitians, those types of things. We might make suggestions about medications to consider, right? Any neuropsychologist, I think there are 2 states in the country where like a psychologist who's not an MD, who has a PhD, can prescribe medication, but that is outside my scope. So I might make recommendation, especially like if I'm giving a diagnosis of ADHD, here are some of the medications that might be useful. I can speak to you about like the pros and cons, what are the options, but then you're going to see another provider to actually to prescribe those medications. And then lots of resources. So books, websites, organizations, support groups, things that might be useful to you depending on like what the question was that you originally came in with, the things that we found on testing that we think would be helpful. So with that is all I have, and I'm very happy to take questions. And please, like that is my email address. If you have questions that come up, if you're like, I did neuropsych testing, I can't tell at all what it means, like send it to me. I'm very happy to like read things, try to, I don't know providers in every area, but I do think I know kind of like what to look for. So if you're trying to find a provider, please use me as a resource. Yeah.
Can they do that?
Yeah, so the question was about, can you come see me? So yes, you can. I would say that, mostly, like I said, I specialize more so in pediatrics. If you're an adult, I would probably refer you to someone I know to come see. And you would just need to let me know. A lot of times in my system, they require an internal referral, but I can put that referral in. So you just have to let me know that you want to come see me, and then you can. Yeah, for the time being you can, but I feel like insurance companies are changing things, and so sometimes they won't cover like an out-of-state provider, so it sort of depends. Yeah, any other? Oh boy, it really ranges. Like I've seen like $3,000 to $15,000, depending on like a $15,000 would be like, that is a multi-day assessment. We are doing like, I think it was like at the Yale Child Study Center that's where they were quoting people like $10,000, and that was like 10 years ago. So I imagine it's increased. But yeah, I think if you were to come, I take insurance, so no one is paying out of pocket to see me, but that's what we've been quoted is like, it's like 3 to 5. But private practice, a lot of times they have different costs. They're not part of this like very cumbersome medical system, so it might be a little less than that. Yeah.
Sometimes you can get a super bill, like you pay out of pocket
Yes.
first, and depending on your own insurance, like if it's a PPO, and you can submit, but you never really know what you're gonna get.
Yeah. Yeah. Thank you.
Okay, so there's already people coming up to ask a question. So before we